My name is Elisabet Hagert. I'm a board-certified hand and orthopedic surgeon, trained in Stockholm, Sweden. I did my postdoc fellowship at Stanford in the US, but now I'm living in Doha, Qatar, so I'm in the Middle East. I'm working at ASSH Orthopedic and Sports Medicine Hospital. So growing up, I mean, every single dinner at home, my dad would come home and he would say something about, oh, I did this amazing case today. And he would always be so passionate about what he was doing. So when I decided I wanted to go into medical school, I thought, I'm going to do anything but hand surgery because I want to set my own path. I don't want to walk the same path as my dad. So I started out by thinking I was going to go into plastics, and then I went into ortho. And then finally, in the end, it's just hand surgery was the most fun. And when it comes to the ASSH, I mean, we had the privilege of hosting several Bunnell traveling fellows. So in 1984, I believe it was, we had Dr. Andrew Palmer, also from the ASSH, past ASSH president. He was the Bunnell traveling fellow, and he visited us in Gothenburg, Sweden. And I was 12 years old at the time. And I just remember I got this amazing connection with Dr. Andrew Palmer. And so in the summer of 1985, when I was 13, he invited me to come to the US and spend a summer with him and his family. So for me, like, the ASSH has always been about having these amazing people coming to visit, and my dad talking about this organization that is so important for hand surgeons all over the world, talking about Sterling Bunnell and Eric Moberg and all of these guys who were just like true pioneers of hand surgery, and how all of them were connected to the ASSH. It's a superb way to network, keep up with both sciences, education, and all of the ongoing platforms and conferences that you have. I would say, for me, without a doubt, the number one thing is the introduction of Wallent by Dr. Don Lalonde. It's like, I still remember the moment I heard him speak the first time. I was in Vancouver, Canada, talking myself. I was sitting in the back of the audience, sort of preparing my talks. All of a sudden, Don Lalonde walks up on the stage, and he starts showing all these videos of moving fingers during flexor tendon repairs and injecting epinephrine into fingers and all these things that we were told that you cannot do this is dangerous. And it totally blew my mind. There was like fireworks going off in my head. And then as soon as I left Vancouver, I went back to Stockholm and I thought, I gotta start trying to do this. And so one of the things I do a lot of is nerve compression surgery. So I treat pain patients. And I thought, why not try to do this like with Wallent? And so what I realized is when you do Wallent nerve decompression surgery, you can test for power during surgery. So what I do, for instance, if you have a patient with a Lacerda syndrome, we do what's called the OK sign, like this. And so ask the patient to resist, and before the surgery, they're not able to resist. Then you do this tiny little procedure in Wallent. 3 minutes later, the power is back on the table, and the patients are just saying, what's going on? You're a magician. This is incredible. So for me, this is without a doubt, Wallent completely changed my practice. I wish we could find better ways to image or show on like a photo or an MRI or ultrasound or something like that, what's going on in nerves with regard to pain and nerve compressions. Because unfortunately, a lot of us work within corporate medicine, and a lot of us need pre-authorizations in order to do procedures. And we are working in an environment where insurance companies are dictating what we can do and not do. And in those events, they are sort of deciding what we as clinicians find, like, is it proper or not? And so quite often you're gonna have people who have no idea what hand surgery is about saying, you cannot do this procedure because the didn't show up on the EMG or the ultrasound. So I wish we could find a way to just like really have super high resolution, like ultrasound or imaging of pain and of nerves so that we can help patients in a better way and so that we can push this through without getting roadblocks from insurance companies. It makes me feel humble. Growing up, I never had a feeling like it's different to be a female as an orthopedic surgeon or a hand surgeon. You know, that's one of the things about Sweden. It's a very liberal society, and I never had a feeling like it was unusual. It was not until I started going more international that I realized that it's really quite rare to have women who are leaders in hand surgery and orthopedic surgery. I've always been blessed with a lot of support from the people I work with. And so regardless if I work with men or I work with women, I've had excellent communities around me, and beautiful mentors have supported me along the way. So for instance, I have my dad, I have Marc Garcia Elias from Barcelona, who is just an incredible mentor, Don Lalonde with his Wallant work. And so those mentors have always left me with a feeling of, you know, anything is possible. You can do anything. I'm not limited as a woman. And that is what I just try to pass that forward to other young female surgeons out there, and therapists for that matter. Just letting them know that it's, you can be a woman and you can have a family and you can have a work and life balance, and you can be awesome because you are a woman, because you see things sometimes maybe a little different than the guys do. And I think we just need to realize our world is not black and white. We need to take into consideration how important gender and diversity and inclusion is. And so I really, really hope that our society, not just ASSH, but globally, can have an open mind to this.